The environment for smoking cessation or nicotine addiction has changed radically over the last 20 years since varenicline or Chantix
Hmm.
was approved. I think, what was it,
Six.
2006?
Yeah.
Yeah. Things have radically changed, and the vaping group has grown substantially.
Hmm.
First, just real quick, how many vapors are there?
About 17 million
17
vapors.
million.
Yeah.
Okay, so that's a large, that's pretty large. That's
Yeah.
a pretty large group. And you've completed a phase 2 and are planning a phase 3 trial
Right.
to add on a indication of vaping,
Yeah.
vaping cessation. Tell us about your efforts there, and what we should expect to see over the next year and a
Sure.
half.
I mean, if you put it into context, we've got a target addressable population of about 46 million. So you got the 29 million smokers plus the 17 million vapors equals a very, very large market opportunity. On the vaping side, we've already agreed the trial design with the FDA. So now it's very much a question of making sure we've got the funding to proceed with that phase 3 clinical trial middle of next year. The trial design is slightly different from the smoking cessation trial. The smoking cessation trial, we treated them for either 6 weeks or 12 weeks. But in the vaping cessation trial, we're only treating them for 12 weeks. And that's simply because there's a view that there is a higher nicotine load in vapors than there is in cigarette smokers. So really, that's the only difference. It's about an 800 patient clinical trial, 400 in each arm. And it'll be over 12 weeks with the appropriate follow-up going forward. So again, I think it adds to the armory as far as treating nicotine dependence. And if you look at it in one respect, the average cigarette's got between 12 and 15 milligrams of nicotine in it.
Okay.
And the average vape equivalent is about 30 to 35 milligrams. So you can see there's
three
times.
Yeah.
And then you expand that into the tobacco pouches, and some of those have got a starting nicotine load at about 50 milligrams. So incrementally, we're seeing that there's an increasing dependency on nicotine. And each one of those has got a slightly different kind of age group population. So typically smokers are on our clinical trials age about 55, been smoking for 25 years, pack of cigarettes a day. In the vaping group, it's much younger. So 33 to 35 years, been vaping for approximately 8 years, and are already starting to experience some health harms related to it. And predominantly that's because the particle size in vapes is dramatically smaller and is penetrating the deep lung. And they're starting to see normal activities like walking upstairs or even doing sports is becoming increasingly hard.